I'm fighting them a little bit because they want me to take her home like this. She's just dripping blood. Like, what am I supposed to do with her? How can they give me back to her like this?
If you've been following me for a while, I like to get on my bike and clear my head when there's stuff that's weighing me down. And so I want to tell you a little story about a friend of mine and her cat. Her cat developed, who knows, a tumor, possibly, very likely, maybe a tooth root abscess. And it went from uncomfortable to a huge bulge behind her eye, which was bleeding profoundly. She took her cat to the emergency clinic. She had $1,000. She's been going through a lot of stuff right now. And instead of being up front, like, man, $1,000 is just getting started. And by the way, tomorrow you're going to have to go to the teaching hospital and spend $3,000 to $5,000 to tell if it's a tooth root abscess or a tumor, and then treatment. So now we're upwards of $10,000 here, right? Just to figure out what's going on and to get started with treatment. Now, I'm not saying the outcome would have been different, but here's a different approach. And colleagues, I come from an era when people were not flush with cash, and they did not have the ability to spend thousands and thousands of dollars on their pets. And unfortunately, things are changing. So I think you're heading back to this time. What would have been most important to this cat and to this pet parent? Giving her something for comfort, for pain, and maybe trying some Yunnan Baiyao to stop the bleeding, to see if that helped, and then telling her her options. And maybe, again, things would not have been different, but that pet parent would have walked out of your office feeling a lot more comfortable with the decision she made, which was indeed to euthanize, than you saying, you can take her home like this. And the photo she showed me is of her cat with a massive swelling with blood dripping from her eye. And her video is, how can they send her home like this? My friends, my colleagues, times are changing, and you have to change as well. Think first of comfort for the pet, of palliating the symptoms in front of you, and then understanding what that pet parent's financial situation is. If we're in an era where they may be able to go for plan A, and that's amazing, you should always tell them all the options. But they may be in a situation where plan D is what they can actually afford. So be prepared to start realizing that is going to happen more frequently, and learn how to support them. You can do so much with a physical examination. You can stick an ultrasound probe up to that eye and get an idea. Is that thing just floating in blood and pus? Or is there something solid in all of that blood? And that will help you help your client make a better decision. I understand you are running like mad people, just trying to keep up. But remember, you went to veterinary school for a reason, and that is to relieve suffering and to help people help their pets.